welcome back. Today I'm talking about what can I do about shin splints. So you will find some links to some other videos of the exercises that I'm talking about in this video. You'll find it in the comments, so be sure to check that out after. So shin splints are a type of problem that if you have it, you would do anything to get rid of it. Shin splints are really pesky and seemingly come out of nowhere. Shin splints are an overuse injury of the muscles in the front of the shin. The pain can be relatively widespread from the front of the shin into the foot, wrapping around the lower leg. Shin splints happen when the muscle on the front of the shin, the tibialis anterior muscle, works too hard and starts having some micro tearing where it attaches to the shin bone. This muscle typically does the action of pulling up your toes towards your nose or up and in, also called inversion. This muscle is crucial to helping you not trip over your feet. So this muscle can get overtired when you walk too much, too far, or ramp up a program like walking or running too quickly. So what's an example of using this muscle too much and causing shin splints? So an example would be someone who normally walks throughout the day for their normal daily tasks at home, at work. Maybe they walk 5,000 steps a day. Then they decide to go on vacation to Disney World and they end up walking at least 8,000 steps a day every day for the whole week they're at Disney World. The first few days would be fine. They're probably feeling okay, but by the end of the trip, those shins are hurting. So what can you do about shin splints? Just like with any new injury, you want to rest the area for the first week, up to 14 days. And by rest, I mean active rest. What is active rest? Active rest for shin splints means as best as you can avoiding the painful motion or activity. Those activities that flare up the shins for pain that's more than a 5 out of 10 on that pain scale of that 1 to 10 pain scale. So what can you do for shin splints? While you're in active rest, you should continue to exercise and do activities that do not bother the shins. So use ice on your shins daily for 7 days, 30 minutes at a time, as often as you can throughout the day. Icing helps calm down inflammation. What exercises can you do? So after the 7 days of rest, it's best to start incorporating strengthening exercises to strengthen the tibialis anterior. Even though you likely aren't going to go right back to Disney World for vacation right away, those are usually planned trips far apart. Once you get back into your normal activities, if you've rested for 7 to 14 days, those muscles are just a little bit weaker. And so if you jump right back into your normal routine of walking 5,000 steps a day, those 5,000 steps a day now could be too much. And you could re-flare up those shin splints. So you'll be right back to where you were. And it will feel like they never are going to heal. So you'll want to do some exercises after that first 7 days. My favorite exercises I'm going to go through today. To get a clear-cut routine for you, go see your local physical therapist. This video is not intended for medical advice, but to give you an idea of what you can do. You should always follow up and speak to your local physical therapist to find out what the right exercises for you are. Okay, so what exercises are my favorites to do when my shins are flared up? My favorite to do are ankle exercises. Why ankle exercises? Because the muscles that cross at the shin also cross the ankle into the foot. So that's how you have to exercise those muscles, is moving around the ankle. Remember, we talked about that this shin muscle's main point is to keep you from tripping over your feet. That means you need to move at your ankle to lift those toes up to not trip over those feet. So My favorite exercises to do are the TheraBand dorsiflexion, TheraBand inversion, plantar flexion stretching. Whew, say that 10 times fast. And to strengthen muscles around the ankle that give support to your ankle, but don't directly work that tibialis anterior are also very important. So those are TheraBand eversion, double leg heel raise, gastrocnemius stretching, soleus stretching, and arch lifts. So that's an all-encompassing ankle routine for strength and stretching to improve the strength of the muscles and the flexibility of the muscles to overall support your ankle joints better. Remember, this is just for general information. Go find your local physical therapist if you think you have shin splints to have a program designed specifically for you. Okay, to recap, shin splints can be pesky. They're so painful and they come back over and over and over and over again, or never go away completely in the first place. Shin splints are an overuse injury of the muscles in the front of the shin that lifts our toes off the ground. We mainly use them when we walk so we don't trip over our own feet. In general, they tend to get overworked when we add a lot more walking or activity compared to our normal routine. To recover, do active rest for 7 to 14 days, work on a strength routine and flexibility routine of the muscles at the ankle to strengthen and support the leg for when you get back to your normal activities. Okay, for more tips and tricks, follow along.